52 episodes, 52 ordinary people, 52 real stories about things that affect overall health. Because there is a lot more that goes into being healthy than food and fitness. Inspiration, support, a new perspective, and knowledge. You'll find that and more here on the Health Ability Project.
Hi, and welcome to the special edition of the Health Ability Project. I'm Robin McKenna. May is Women's Health Month, and so the episodes this month are dedicated to some very important women's health topics. On this episode, we are going to talk about women's health equity, what it is, why it's important, the state of women's health equity both abroad and here in the U.S., and we're going to hear how health equity has impacted the overall health and well-being of women. My guests today are Caroline Weinberg, Jennifer Fink, and Marissa Fayer. Jennifer is Chief Strategy Officer at Lutech Industries, a woman-owned and operated medical technology company. Lutech's mission is to create medical solutions that allow healthcare providers to deliver top-quality care while improving the patient experience. Jennifer's work in the femtech space has led to the creation of the first high-definition, fully portable, and telemedicine-capable colposcope that expands access to life-saving cervical cancer screening and treatment in remote and low-resource settings around the world. Caroline Weinberg is Executive Director and founder of Plan A free mobile reproductive health clinic in the Mississippi Delta. And Marissa Fayer, who was the very second guest on the Health Ability Project podcast, is a 22-year veteran of the medtech industry and the founder and CEO of Her Health EQ, a nonprofit working to improve the health outcomes of women by providing essential medical equipment to developing regions around the world. Their projects are touching lives in India, Tanzania, Burkina Faso, Vietnam, Costa Rica, Jamaica, and rural Mississippi. Ladies, I can't thank you enough for being here today. This is just going to be such a great conversation. So thank you very much. And I would love to start it off with Marissa, if you could explain for our listeners what exactly health equity is, and then we're just going to have an open conversation of why it's important, what is going on in the areas that you focus on, share a little bit about your background, and then obviously also the stories that you've come across in the work that you do. So thanks very much, Marissa.
Yeah, so just to level set, health equity is making sure that everyone has the equipment, the tools, and everything to be almost viewing at the same level, but the types of health outcomes that are needed are different for where you're working and you're living. So while, to give an example to make it very obvious and contextualized, somewhere in the US, it's standard of care to have a mammogram for your breast cancer screening. But in other remote regions of the US and other parts of the world, that equipment is not available. So ensuring that there are ultrasounds or handheld other diagnostic equipment or thermal imaging scans that are providing similar types of outcomes and responses to make sure, and diagnoses, to make sure that there's still care. It just looks different depending on where you live. And so health equity is, and especially in the context, I think all of us are, I know a lot of us are working in healthcare and in the medical device industry as well, is making sure that the correct kind of equipment is available for where anybody is living. And it doesn't have to be the same across the board. That's not necessarily what equity is. It's making sure that there is care for a particular health condition wherever anyone happens to be.
Great. So ladies, why is health equity so important? Do you each want to take a crack at that?
Sure. I mean, I'll start and then I'll stop talking, which is great. Which is always great when we're on joint calls too. So, health equity is important because all people deserve access to healthcare, regardless of where they live. And again, it potentially looks different depending on where they live. And so everybody, a woman, a man, a child, if you live in Midtown Manhattan, or you live in rural Mississippi, or you live in a remote region in Tanzania, all deserve access to healthcare. And so that's why health equity is important, to make sure that there is an equitable standard of care, that there is care and healthcare for everybody. And it shouldn't be dependent on where you live, having access to quality healthcare.
Thanks. Jennifer?
Yeah, to add to that, I think everything Marissa said, except to add that it shouldn't matter what your gender is either. So being able to address, those specific needs for women everywhere in the US and abroad as well, regardless of, race, class, economics, all of those things, having everything be accessible that is needed for both men and women.
I would just add, healthcare from my perspective, and I'm sure from everyone on this call, is a human right. So everybody deserves access, regardless of where they live, what their background is, who they are. Everybody should have access to equitable healthcare. But I think an additional element of it, though, is that one of the reasons healthcare equity is so important is just because there are so many inequities across the board facing people in their lives. And when you are living an unhealthy life, it sets you back in everything else. You miss work days, so it impacts your economic future. You miss school, so that you can't move ahead in whatever career path you want. You're not able to take care of your kids. So kids whose parents are suffering from health issues, sometimes have health issues of their own. It's this whole spiraling effect where if we don't focus on making sure that people have access to the healthcare and the healthcare treatment that they need, it's just this ripple effect that exacerbates all the other inequities that people are also facing in their everyday life.
I would also gather that creating this health equity, this access to care, oftentimes allows women to be aware of a condition that is progressing to a negative state and would allow an individual, I guess man or woman, to seek treatment earlier on in a disease or a condition, versus if they did not have access to this health care, they might not learn of the issue until it's too late, or when care becomes very expensive or difficult to endure.
It's that, and it's also sometimes people, I run this mobile women's health clinic in rural Mississippi, and one of the reasons that we ended up getting a colposcope, which we got from Lutech, was because we had patients who, you're supposed to get a pap smear every 3 or 5 years, depending on kind of what kind of test you've had. And we had patients who were coming in who had either had a positive pap in the past or hadn't had one in 5-10 years. And they would say, well, I don't have insurance. And if I had an abnormal pap, I know I wouldn't be able to do anything about it. So why find out, basically? Which is, and so that's the point at which we were like, okay, well, we clearly need a colposcope, because putting off care because you can't do anything about a problem is obviously not a solution. But it's the situation that a lot of people are faced with, is that you put off care either because you don't want to know, because you can't do anything about it. So why see the horror that's ahead of you? Or because and sometimes things advance because if you can't afford to or can't physically get the care that you need, by the time you finally get there, things have progressed to a point where you can't necessarily take care of it. The kind of classic example is catching and treating diabetes early versus someone showing up where it's so advanced that they have a limb amputated, because you can't get access to that consistent care you need.
Mm-hmm.
Yeah. Can I just add also, I think, to add to what both of you are saying, the presence of trauma also increases your likelihood of having, cervical cancer, other cancers, heart disease. And so being aware of that, I think, in certain environments and allows you to, look for certain indicators of like heart disease and cervical cancer, things like that earlier, so that you can detect it that way. So I think it's both, kind of like what Caroline's doing with the mobile clinic, making sure that she's providing access to women who don't have that standard annual or every 3-year tab, but also, considering the population that you're working with and understanding what they're predisposed to, and if there's trauma there, and prevalence of trauma allows you to detect these things earlier.
Mm-hmm. Jennifer, tell us a little bit more about LUTEC, the colposcope, and the work that you're doing out there in the field.
Thanks for that question. LUTEC, we're a woman-owned company, and we manufacture medical equipment like digital colposcopes. And so just in case people don't know what colposcopes are, a woman will receive, like here in the US, a PAP, and that will indicate whether there's further information needed to determine if there's cervical cancer or predisposition to cervical cancer. And the next step would be to get a colposcopy, which is a visualization of the cervix, to determine if there's next steps needed. So we we brought to market the first high definition digital colposcope back in 2016. And so we use digital technology instead of something like a microscope that's easier to use, and it connects to computer or telemedicine and allows providers to track changes over time and use that to refer to other specialists, and it's kind of like a more updated version of that. So what we do here in the US is we provide our colposcopes to private practices, teaching facilities, mobile clinics, sexual assault, forensic nurse examiners, child advocacy centers, anybody who is looking for an innovative, more up-to-date piece of equipment that will allow for internal exams and colposcopies.
What have you seen or have you heard when this mobile colposcope is brought to a community somewhere in Africa? I know you've been working in many different countries, and when we spoke, you had shared with me a whole bunch of really fascinating things as far as the impact of the work that you're doing. I'd love for the audience to hear a little bit more about that.
So Marissa has a nonprofit, Her Health EQ, and she can tell you much more about what they do. But basically, she works to facilitate the donation of medical equipment specifically for women's health in areas where that might be lacking. And so she has a project that we've partnered with her on. It's called the 10 for 10 project, where 10 countries have been selected to receive 10 colposcopes each, which will hopefully expand access to cervical cancer screening for 480,000 women a year. So in
each country?
Total, all over. And that would be every year. So these devices will last, greater than 10 years. So hopefully in each country by the time, it's done. So in Ghana specifically, there's this amazing doctor out of the Catholic hospital in Bator, Ghana, who has been studying concurrent HPV DNA testing with visual inspection with a colposcope, which means basically a PAP and a visual inspection at the same time to increase the chance of a one-time diagnosis and treatment. And so we're fundraising to donate those 10 colposcopes, where he will set up a national program so that midwives can go out into rural areas of Ghana, to places where the women there maybe can't afford to take a 3-hour trip into a hospital or pay for childcare, and the nurses can come to their location and set up a diagnostic center, similar to what Caroline's doing in areas here, to provide on-the-spot screening and then treatment for parts of the population that wouldn't necessarily have access to this care otherwise.
Yeah, one of the things that we really have to understand, especially on a global scale, is that the infrastructure is not similar to what we have. So I'm not saying that the remote regions only have dirt roads. I'm not saying that. But when you talk about outside of, a suburban area, peri-urban area, the infrastructure is not there. So this is sometimes maybe once, maybe twice in their entire lifetime are women having access to cervical cancer screenings, maternal screenings, breast cancer screenings, all of these things. And so, having things that are more handheld, having smaller devices, having remote and traveling systems, in the US and also around the world, like we have to consider that care should and can be delivered where the patients are. And we need to meet them where they are, because we cannot expect any woman every year to take off an entire day of work, and whatever work means. That could be, that could be in the field, that could be in a shop, that could be in a job, that could be, caring for their children, to have the time every single year to come for an annual screening and, take the time off. And, what does that mean? And there's also social and societal norms that is not normal to have unless you were pregnant to get screened for, for other types of diseases. A lot of people just in the world, a lot of people just think women's health is delivering a baby. And unfortunately, there's a whole lot of other things that happen throughout a woman's body and throughout a woman's lifetime. And so when we think about it on a global scale, we have to serve the patients where they are. And oftentimes that's not with a massive piece of equipment. And, when we're talking about remote systems, Caroline is doing it incredibly in Mississippi, but then we talk about like those mobile systems wouldn't even get and be able to traverse in some of these more rural regions in other locations, rainy seasons and floods and even droughts and things like that. There's also people who are moving around. I mean, you think about it this in conflict areas, people are moving around so quickly and so dramatically. Just because you set up a location there last year, it could not be there again. And I'm not saying that that the rest of the world is very, war torn and all of that, but you have to understand when we're talking about more remote regions, it's not that there's a highway connecting it to get you there.
Mm-hmm. Tell us, how is the work that you're doing down in the Mississippi Delta, how is that being received, and what kind of stories are you hearing? And is it a van that is traveling to different communities, or is it multiple vans? What exactly is mobile by your definition or your program?
Ours is a truck, which is a very important distinction if you're the person who's driving it. But conceptually, it is a mobile clinic is an exam room on wheels. So ours is as I said, a truck with two fully functional exam rooms that can do basically any type of healthcare. They're set up to do pap smears and colposcopies and IUDs and STD tests and HIV tests. We can do it all in our clinic. And it focuses really on reproductive and sexual health care. And one of the things so mobile clinics are a remarkable way of getting care to some of the most vulnerable communities, both internationally and in the US, because it addresses the major barriers to care of distance. So people have to travel a really far distance to get to the care that they actually need. That is, if they can afford it. A lot of people in our communities are either uninsured or underinsured, which means they're insured technically, but they can't afford their copays or their medications. So their insurance is pointless, essentially. And also the time, it takes a really long time to travel from A to B in some of these rural areas. If you don't have a car, you have to find someone who can give you a ride. If you can't find someone who can give you a ride, you have to hitchhike or you have to put off care. And the advantage of things like these mobile clinics is that they can bring care directly into those small communities. Our average town size is less than 900 people.
Wow.
And what people always say when we go into them is thank you for not forgetting that we need help too. Because there is this expectation that you'll just kind of figure out how to get to the doctor, even though it's 2 hours away, and you'll have to take time off work and you have to coordinate it. And if you want to go to a doctor that you can afford, you might have to travel 5 hours away. And it's just these astronomical barriers to care. And that's why mobile health is so important. But I also think a really important element of this is that we've allowed women's health to be kind of set aside as a separate topic from broader healthcare. And that means that there are a lot of primary care providers who just like don't deal with the stuff that they consider like the women's stuff. Like they won't do pap smears and they don't talk about family planning and they don't do that stuff because when they were trained, that was the lady doctor part. And then there's the primary care part and the two don't get combined. And that's a really, really big problem when you're talking about rural communities, because if it is so hard for you to get yourself in front of a provider, like when you get to that provider, they should be hitting you with every single thing they can possibly give you. Like if you go there because you need your blood pressure checked, they should be offering you an HIV test. They should be offering you family planning. They should offer you STD testing. Like I get that a dermatologist maybe it doesn't have their office set up for a pap smear, but that doesn't mean they can't offer you birth control. And so we really do need to stop kind of these divisions of who can do what kind of healthcare, especially when you're in rural communities, especially when you're international, and having accessible and low cost testing equipment like colposcopes, like rapid tests for different diseases is so important to decrease those barriers. And the easier they are to use and the cheaper they are, the more accessible they are to bring to everyone. You know, like I can give someone a rapid syphilis test for $12. And that is the difference between doing it right there versus paying, $50 to send out the test. And then you have to track down the patient with the result and all this stuff. So the faster we can streamline things with tech, kind of the more we can get people while they're right in front of us. Sorry,
I love
my big soapbox topic.
Well, I loved it. I was here for it. So I would like to just add with the tech, I love that that's what so many people are doing now here in the US and abroad with telehealth platforms, integrating them. We kind of talked a little bit earlier about the work that we're doing in the sexual assault space. A lot of states and programs are using telehealth with specialized sexual assault examiners in other locations, so that when you're in a rural area and you've been sexually assaulted and you have to travel 3 hours to a hospital, and then you have to wait 3 hours for the specialized examiner to come, instead of having that process take 6 hours for the survivor, they're able to use an ER nurse who's not specially trained, log into a telehealth platform where a sexual assault nurse examiner is logging in from home, and they're able to advise that ER nurse or doctor on how to perform a trauma-informed exam that collects the proper evidence and treats them on the medical side as well. I love that. I love that we're able to use all of this new technology to make the experience much better for the patient, as well as easier for the providers as well.
Right. And making the access or making the process of the particular care that they're going for easier for the patient, especially in the circumstance of sexual assault. The peace of mind that gives the patient is so, so valuable. Just mitigates the stress, mitigates the worry. They feel safe, right?
Yeah. Definitely. Yeah, that's that trauma-informed care aspect, I think, like leading with the idea that whether it's in the sexual assault space or OBGYN or somewhere else, just acknowledging that, what is the statistic? 1 in 5 women have been sexually assaulted in the US, and that's probably underreported. So just leading with that concept that there's the potential for trauma to have existed, and it might prevent somebody from asking the right questions or seeking the right care, and that the provider at that time is kind of the doorway to what Caroline was saying, like the doorway to other services and the opportunity to be treated for other issues, anxiety, depression, whatever.
Yeah. So what can the average person do to help this movement of health equity, to help support you ladies and everybody else that is out there working to literally on the ground, like Caroline in particular, to bring health equity to women in rural or disconnected communities? What can somebody like I do other than write a check? Are there volunteer opportunities? Are there, I don't know, other awareness activities that we could embark on? Thoughts, suggestions?
Well, I mean, there's always check writing that helps, like you said, Robin. So, I'm not gonna diminish
no
that.
complaints here.
Caroline and I will both take them. So, we cannot ever say no to checks. So that's one. I mean, with any nonprofit, there's obviously boards, board of directors and boards of advisors, and there's advocates, people, Robin, like you, who want to get the message out. And there's other people who should just be talking about it. Listen, just people starting to talk about it and caring about what this is starts those conversations and starts getting people involved. And then, it could be anything from volunteering and helping on a marketing campaign, or going to a march, or doing a race and raising money, or, even going for a walk or whatever, like kids having lemonade stands. I mean, right. There's so many ways to do this. It's people going out and speaking about it. It's listening to podcasts. It's hearing about other people in this world that are outside of often our small little bubbles. Mm-hmm. And to understand that there are people, probably, most people who are listening to the podcast are probably incredibly fortunate. And there are most people who are not like that. And, not to say that everything needs to be charity, but it's more having an understanding that people are at different levels. And that doesn't mean that they don't deserve healthcare. As Caroline said, healthcare is a human right around the world, no matter who you are. And so the fact of the matter is, that's what health equity is, making sure that every single human has access to healthcare. And so thinking about it, caring about it, volunteering. So any person can do that and can start the conversation, and you can have a conversation with somebody else, because you also don't know if they don't know. And you've just educated somebody new and opened their eyes up to something different. And I think that's how movements start. That's how revolutions start. That's how change happens. It's typically one person at a time.
Right.
So yes, second, obviously, like, donations make a huge difference, and everybody, obviously, like, everyone who runs a nonprofit is chasing that $1 million gift, but like $50, like a pap smear costs $50. So little gifts.
Many hands make light work. Many hands make light work.
But in addition to that, what I would just say is that everything's terrible right now, right? Like, the state of pretty much everything is awful, and it's very easy to focus on how terrible everything is. And I think that it's important to, like, sit in that for a minute. But I also think, like, don't sit in that to the point that you forget that there's always something you can do. And I can guarantee you that every single human being on the planet that has some skill that someone at some nonprofit who's working on health equity can figure out how to put to good use. If you're a good writer, you can help with grant applications. If you're a good artist, you can help with graphic design. If you know how to drive, you can volunteer how to drive patients from their homes to providers' offices. There's literally always something you can do. So feeling like, oh, I don't have money, I can't help a nonprofit, or, oh, I can't sit on a board, whatever, that's not an excuse. Like, there's always something that you can do, and you can reach out to a nonprofit that is, or a company, whatever, that is doing work that you think is good, and just say, like, these are my skills, can you use them? And find a place to put them to use, because there's always something that you know how to do that some small nonprofit where everyone on their team is doing 400 different jobs will happily give you one of those 400 to take on for yourself. So just think about what you have to offer, and try to figure out a way to contribute that to people who are fighting the fight to increase access to health equity, both in the US and around the world.
Robin, I also think there's a really important movement that's starting to happen in corporations too. Some of these volunteer days and give back days and things like that. So even people at corporations, so like, tell your company that you want to have a give back day, or that you want to, work with their CSR teams to work with one of our types of organizations, or things like that. Be our advocate inside companies as well, because companies have far more capital most of the time than individuals. Right. And so if you have an advocate in a company then that helps tremendously just to get to the right person to speak with. We don't ask you to speak for us. We ask to get us in front of the right people who can make those decisions so that we can tell them what we do and why we need their help. And then also how we can engage their employees. We all know that employee engagement right now is one of the hottest topics, and it's so necessary to retain talent. So making sure that your employees are active and caring and know that they're working for a company that actually cares about something and does it. And even if it's one day a week or 1 day a year or 1 day a quarter, or however, companies do it differently, or maybe they'll give you time off that's paid to volunteer. And that could be painting a clinic. I mean, in a lot of the emerging markets that we work in, a lot of these volunteer days are going into the communities that they can access because they're local and handing out pamphlets or pieces of paper to say these services are coming, or this is why they're important, or they exist. Go get a pap smear, go get a cervical cancer test screening, go get, a mammogram, go get these things. This can save your life. And it's not as Americans coming in to do this. It is a local community empowering their own local community to do that. And, this is where employees and employers can work together and really catalyze the work that nonprofits are doing. And knowing that there's so many also smaller nonprofits that are doing just as incredible work as some of the larger ones, oftentimes more so on the ground than the larger ones. We all need to work together. We cannot do this independently. The large ones can't do it without the small ones. The small ones can't do it without the large ones. We all have to do this together. And that's how health equity, that's how health becomes equitable. Right. Yeah.
Can I just say one thing off of that? My other soapbox is that I understand why people consistently donate and volunteer their time with organizations that they've heard of. They donate to the big ones, to like the Planned Parenthood, to the Red Cross, whatever, because they're vetted and they know them. I'm not knocking those organizations, give them money, that's fine. But if you take a chance on a small organization that you haven't heard of, that's deeply embedded in the community and doing work, your $500 donation is going to go a lot farther for them than for a giant organization. So take a chance, investigate the local places, look at the small organizations, and consider supporting them and having that impact. You don't have to always donate to the same places over and over again.
Thank you for underscoring the importance of that. It's something that I truly believe in. It's these grassroots organizations in your local communities that really are doing the most valuable work. And again, that's not to take away from the big organizations, because those big organizations were once very small too, and it's just a matter of continual and consistent messaging over the course of a great deal of time. I mean, look at the Susan G. Komen Foundation. I think it took 30 years, but now the rate of breast cancer is way down. There's just so many little organizations that have the ability or the capacity to do great work, and we just need to support them more so, I think, than the larger ones. And you're right, the money to those organizations does go a lot further because they work on more of a shoestring budget. So thank you for raising that. So Caroline, I'm going to close out with this one question for each of you. Marissa, I do know your story, but if you could repeat it for listeners, what was it that drove you to do what you're doing, and how has this affected your overall health and well-being? Caroline?
I mean, I've worked in the reproductive health space for for more than 20 years at this point, and have always focused on increasing access to care in low resource settings. I worked internationally and in the US, and it's that because we have segmented off access to so many things of women's healthcare, you notice that the barriers that people face to healthcare in general are just so enormously amplified when you're talking about anything that has to do with reproductive health. And the challenges are so much more significant. We know that, speaking about the US, women in rural areas are less likely to get access to reproductive health care or prenatal care than people who live in urban centers. And it's just it's spectacularly unfair. And that kind of injustice irks me. And that's how I got involved in this space. I started working in Mississippi, specifically around family planning access, while, over the last couple of years / 50 years, watching like access to reproductive health and abortion slowly constrict, and kind of focusing on the states where people are the most vulnerable, which are the kind of deep South states, especially in rural areas where people just can't access anything that they need. And what I have found working down there and working in kind of states all over the country is just that there are people who are doing extraordinary work on the ground, fighting the good fight to make sure that people have what they need to survive, you know. And one of the things that often comes up when we're talking with patients who are explaining why they haven't gotten healthcare or why they don't have insurance, or, you know, they're always giving us the story. I didn't do this because I couldn't take off work. I lost my insurance because I had to quit my job, XYZ. And what we're always saying to them is like, it's not your fault. The system is built to fail you. This is not something that you did wrong. And working with people, both our team at Plan A and also just all of the amazing clinics I work with, to try to kind of correct that injustice and increase the equity around women's health, I think is what kind of keeps me going. In terms of what it's done to my personal health, it's extremely stressful, and I'm probably losing my mind a little bit. But in general, you know, I think it is a constant reminder that, you know, I get my pap smears when I'm supposed to, because otherwise I feel like I'm not living up to what I'm trying to encourage other people to do. But yeah.
Jennifer?
So, I mean, you listen to Marissa, you listen to Caroline, right? I found myself in, this position at Lutech as a sales rep almost a decade ago, and just being exposed to all of the amazing people like these two women who are just so passionate about what they're trying to do, and their blood, sweat, and tears is going into this. And it's really hard not to want to get involved from my perspective. I feel that I'm very fortunate to be in the position that I am in, doing something that I love and that has the opportunity to really expand access to care for women and children everywhere. And I feel just being exposed to women like this who are, or anybody like this who's very passionate about this cause, makes me want to get involved and participate as well, because I think that there's just too many people that need access to healthcare here in the US and outside. And if there's an opportunity to participate in that, then that's where I want to be.
Beautiful. Marissa?
Yeah, I mean, I got into this solely by accident. I've been in healthcare for 23 years. My passion was always women. I started working for a women's health company, the largest in the world. And I was also grateful to move to Costa Rica with that company, where I saw that women didn't have access to a mammogram machine because it broke down years ago. Well, I just launched the newest, fanciest version at my corporation, and women in that country didn't even have access, to a piece of equipment. And so I thought that was just a little, ridiculous in my mind. I'm an engineer. We solve problems. And so, so I formed Her LTQ many years later, and continue to make sure that women have access to the healthcare equipment that they need for the non-communicable diseases, because it's exactly, Caroline said it before, when women don't have their healthcare, it translates into their children not going to school, their children also not having everything that they need, women not having as much money to support their families. And I don't know if this is the statistics in the US, but imagine it is as well. Around the world, 90% of a woman's income at least goes to her family, 45% of a man's does. And so making sure that women are income producing to provide for their families is incredibly important. But unfortunately, if they're not healthy, they're not able to do that. And they're not able to send their girls to school, because the girls are the first ones that get pulled out. And as a woman in STEM, I just think that is unfair. And that's, I can't fix the education system, as I'm in healthcare. I decided to deal with some of the education or some of the healthcare issues. And so just being able to travel and having the access to do that has opened my eyes up to see that there's so much left to do. And it's startling in the US, it's startling around the world. It's not getting, it's getting better in some respects. It's not getting better in so many others. And it needs to consistently get better. And that's not happening. And making sure that women are healthy is probably part of the solution. I would say it's women and girls who change the world, and they just need their health to be able to do that. And then I think that's what all three of us, actually all four of us, including you, Robin, like are working to do. And that's what needs to happen to get to this, to the space where, where you started this, where there is health equity.
Right. Thank you, Marissa. Thank you. And I think that's important to, what you said earlier. It's not, I think so many of us don't understand the big picture consequence of a woman not being able to get to her cervical cancer screening or her annual mammography. And the ripple effect is just so detrimental, not only to the woman and her family, but to everybody. Because if a woman can't provide for her family, the kids can't go to school, then there's less productive people in society. I mean, it just goes on and on from there. So thank you. Thank you for elevating that picture for people. I can't thank you enough. This is, I could talk for hours on this subject. So thank you so much for being on the Health Ability Project. Listeners, if you enjoyed today's episode, please like us, share us, post on social media. And if you have any questions, comments, or suggestions, you can reach me at thehealthabilityproject@gmail.com. Thanks very much. And don't forget to tune in next week as we continue our special edition on topics important to women's health. Thanks so much.
Thanks for joining us today at the Health Ability Project. We'd love to hear from you, so please email us your questions, comments, or suggestions, including future guests, to thehealthabilityproject@gmail.com. And please like us, subscribe, and share us with your friends.